There is also another similar disease called Parkinsonism, which is a condition in which people have some of the symptoms of Parkinson's disease, but do not have Parkinson's disease itself. Parkinsonism occurs when one or more of the regions of the brain that are responsible for Parkinson's disease become damaged. One of the early symptoms of Parkinson's disease is a loss of the sense of smell, which can happen years before other symptoms appear. The symptoms of Parkinson's disease and Parkinsonism also include a fine tremor, which is very noticeable in the hands and arms and happens when the hands and arms are at rest. Beyond loss of sense of smell and tremor, Parkinson's is associated with several other physical symptoms, including slowness of movement, bradykinesia, rigidity, stiff muscles, and postural instability. These symptoms can make walking or generally moving around extremely difficult and can lead to abnormal body posture. Additionally, people who have Parkinson's disease or Parkinsonism often have very little facial expression, which is typically called a masked face. The areas of the brain involved in Parkinson's disease and Parkinsonism are called the substantia nigra and the basal ganglia. Parkinson's disease is normally caused by slowly progressive degeneration of these two areas, which control the rhythm and smoothness of our movements and the tone of our muscles. As the substantia nigra and the basal ganglia degenerate, the typical symptoms of Parkinson's disease begin to emerge. Certain health conditions or sudden damage to the substantia nigra or the basal ganglia are associated with onset of Parkinsonism. These conditions include head trauma, brain tumors, infections in the brain, and stroke. Most of the time, the symptoms of Parkinsonism appear when injury or damage to the brain occurs, rather than in the gradual progression characteristic of Parkinson's disease.